I'm Kezia Fitzgerald, a two-time cancer survivor and bereaved cancer mom, and I'm the founder and creator of CareAline, which takes the patient perspective and uses it to drive clinical change in the hospital system, increasing safety and comfort for patients with complex medical needs. Imagine getting a new diagnosis, feeling scared, confused, and overwhelmed, having to deal with an avalanche of new information, and on top of that, a tube hanging out of your arm or chest that connects directly into your heart. Terrifying, right? Central venous access is essential for patients as medications like chemo, high-dose antibiotics, and other treatments can be damaging and uncomfortable, but central lines come with risks that can be even more dangerous than the treatment. Without standardized securement, patients are left to find their own solutions to manage their lines. My daughter and I battled cancer in 2011, and after being told the potential dangers, bleeding, infection, delays in treatment, and even death, we turned to our nurses to keep us safe. It was unacceptable that their only option was to tape it down or cut off a sock. I made the first sleeve and wrap for my daughter, and we saw the impact immediately for us and the nurses and doctors. I made them for other families, and they loved them. I quickly realized how this could improve the health and lives of not only pediatric patients, but adult patients as well. The CareAline sleeve and wrap were iterated from these prototypes. As comfortable to wear and discreet as regular clothing, and easy for anyone to use, line care becomes a simple task. The sleeve and wrap keep lines off the skin and covered, protecting the patient and the line itself. Our patented pocket keeps lines put away and clean while not in use, and our two-layer design keeps lines stable and secure when connected to an infusion. Living with cancer and working with clinicians for almost 10 years, I strive to develop products that solve both clinical and patient needs in effective, simple-to-use devices. This holistic approach to solving a challenge is a result of innovating from the patient perspective and keeping a patient-centered approach to design. We work closely with the clinicians and patients using our products and incorporate their feedback and suggestions into product improvement and product innovation. Since our time at MassChallenge in 2017, our utility patent was issued. We also had clinical trials successfully completed showing that our sleeves and wraps, when used as standard of care, reduce the risk of the most common line complications, dislodgement, breakage, and infection. We turn to our nurses first for solutions, so we know our products need to be provided to patients when their line is placed, reducing patient stress and lowering hospital risks and costs. We have over 40 hospitals using our products, and many using them as standard of care. The patients receive the product at placement, and it goes with them to their home, the clinic, and back to the hospital. It's complete hospital-level care wherever they are. With hospitals as our primary customer group, we establish relationships leading to consistent and increasing repeat orders. Adding more hospital contracts leads to sustainable growth, and adding more product offerings expands use in current and prospective hospitals. In 2019, I went through a stem cell transplant. During my 4-month isolation, I finalized one product, prototyped and tested another, and grew a new immune system. When the world joined me in isolation, we asked our hospital partners how we could help. We had our manufacturing facility make reusable isolation gowns with clinician-requested features. We are happy to have helped some clinicians, school nurses, and dental workers through the pandemic. While making the gowns did not move the needle forward for CareAline as a company overall, we did learn technical manufacturing skills that will help us in future projects. In 2022, we refocused on our vascular access devices and launched our Pro Plus sleeve and wrap, which hospitals quickly adopted. These were developed from clinician feedback to work better for patients on continuous infusions and is a turning point for faster adoption as it fits better into inpatient workflow and protocol, leading to easier integration. This helps us reach more patients at the time of line placement, an overwhelming, emotional, and stressful time when patients and families need the most support. We have 2 trials currently underway. When our detour into producing isolation gowns had a positive social impact, it had a negative financial impact on our business as a whole. The Alumni Prize could help us get back on track by supporting Pro Plus design improvements and design and development costs for new products that have been requested but put on the sideline until funding can be acquired. This foundation will lead to contracts in larger hospital groups, GPOs, and distributors, increased use of the products, and development of additional products that patients and hospitals need. Imagine having one less thing to worry about after an overwhelming diagnosis. Our products have helped over 15,000 patients stay safe, but there are over 13 million U.S. patients a year who need our help. This prize can help CareAline reach them when they need us most. Thank you.